Hi fellow future RNs! Kung isa ka sa mga nag-request ng discussion about NCP, then this video is for you. NCP, or Nursing Care Plan, is part of the nursing process, which outlines the plan of action that will be implemented during patient care. NCP helps us prioritize the care that we give to our patients. There are different types of nursing care plan and different formats, when it comes to nursing care plan. But what we're going to talk about here is the student care plans, yung mas mahaba, yung mas detailed na care plan. Okay, so that includes assessment, nursing diagnosis, planning or expected outcomes, interventions, rationale, and evaluation. So usually yung makikita nyo, may makikita kayong format na ADPI lang or yung assessment, diagnosis, planning, interventions, and evaluation. So that's your ADPI. So, pero karamihan din kasi ngayon gumagamit na ilalagay na ng column 4 rationale. So para sure ka kung anong format ang gagamitin, mas maigi kung manggagaling sa iyong teacher's instructor or clinical instructor. Okay, so let's start. Okay, first step sa paggawa ng nursing care plan is, of course, syempre, ano bang nauuna lagi sa nursing process? Assessment. So, ang una natin gagawin ay data collection or assessment. So, saan ba tayo, saan natin nakukuha itong mga data na to? No? Syempre, nakukuha natin to sa during our interview with the patient, physical assessment, medical records, yung galing sa chart, and also kasama na dyan yung mga diagnostic studies, yung mga result ng blood test or imaging results. Okay, so after mo makollect yung data, yung assessment data mo sa patient, kailangan mo yung i-organize. Kasi from those data, mag-formulate ka ng nursing diagnosis and your priorities and outcomes. So things to remember about sa assessment, meron kang dalawa dyan. Meron kang yung subjective cues and objective cues. So kapag subjective, ito ay anything na galing sa iyong patient or sa relative na verbalized by the patient or relative or kung sino na interview mo. Like for example, kung bata yung patient mo, syempre yung kausap mo sa interview is yung parents or yung mother. So that's your subjective. Verbalized as verbalized by the patient or the relative. Ang iyong objective naman, anything na na-observe mo as a nurse, yung na-measure mo as a nurse. Like for example, kasama dito yung ating vital signs. Kasama dyan, ano pa, yung mga na-observe mo sa patient. Kunwari, kung may mga grimace, napansin mo, mga ganon, difficulty of breathing, use of accessory muscles, mga ganon. So that's objective. Basta lahat ng verbalized subjective, lahat ng na-observe mo sa patient, nakuha mo, na-measure mo, like your vital signs, pag BP mo, heart rate, yan ay nasa objective. So yung mga lab results sa objective din yan. Kung yung mga results ka ng mga blood test, ganon, or imaging results, under yan sa objective. Okay, so let's say, nakuha mo na, tapos ka na sa assessment, na-organize mo na yung data mo. Now, ang next na step is mag-formulate ka ng nursing diagnosis. Nakalimutan kong banggitin, there are many applications online na pwedeng ma-download or kahit mag-search ka lang sa Google, makakahanap ka ng mga NCP na pwede mong maging guide. No? And also, guide din also in making your nursing diagnosis. Kasi yung ginagamit natin ay yung NANDA-approved na mga diagnosis. Pero sa mga students, sa amin kasi bawal ang cellphone o bawal ang device. So, much better meron ka nung NANDA book. Hinahanap ko yung NANDA ko na book, hindi ko makita. So anyway, mag-flash na lang ako ng picture kung anong itsura niya. Kasi nandun yung may guide doon ng mga nursing diagnosis. And meron na rin doong mga interventions na pwedeng mag-guide sa'yo kapag gagawa ka ng NCP. And syempre yung nursing diagnosis mo, dapat sinusupport ng assessment mo. Okay, so kung ang nursing diagnosis mo is elevated body temperature or hyperthermia or yung fever, dapat meron ka sa assessment na pag-check mo ng temperature, nasa objective mo dapat yung temperature na lalagpas ng 37.5 or meron kang subjective yung nagsabing I feel hot, as verbalized by the patient. And remember na kapag gumagawa ng NCP, nagpa-prioritize tayo. Yung uunahin mong diagnosis. Kasi may mga patients na maraming mga problem, no? Hindi lang iisa ang pwede mong NCP sa isang patient. Alin doon yung uunahin mo? So ano yung mga pwede nating basis kapag nagpa-prioritize? So una na dyan, syempre pwede natin gamitin ang ating ABCs or yung ating airway, breathing, circulation. And isa din maliban sa ABCs, may isa rin tayong ginagamit, yung pwede natin gamitin yung kay Maslow, yung hierarchy of needs, diba, yung sa pinakababa yung physiologic needs, so ganun tayo mag-prioritize. So kapag meron ka ng nursing diagnosis, ang next is planning or sa ibang format, sa ibang version, expected outcomes. Dito, i-describe kung ano yung mga gusto nating ma-achieve after natin i-implement yung mga interventions. Siyempre based pa rin sa ating nursing diagnosis. So ano yung dapat nating tandaan when we're setting expected outcomes? So ang kailangan nating tandaan is ang ating planning kailangan ay SMART. S is for specific. So specific dapat ang goal. Ano yung gustong ma-achieve. It should be clear, significant, and sensible, para maging effective. Next is measurable. Kailangan namin measure. For example, instead of saying lang na the patient, after 8 hours of nursing interventions, the patient will feel pain relief or the patient will be relieved of pain. Paano natin yung ma-measure? So instead of saying that, pwede kang maglagay ng pain scale. Like, kunwari, mag-decrease ang pain scale ng patient from 8/10 to 5/10. Ganon. So for it to be measurable. Next is attainable. So dapat hindi imposible yung mga planning natin. Like for example, if you are taking care of a cancer patient, hindi ka pwedeng maglagay ng planning ng after 2 hours of nursing intervention, the patient will be free of cancer. Diba? Hindi attainable yun. Okay. Which brings us to the next is realistic. No? So hindi rin realistic yung binigay kong example, diba? So it is important to look forward to effective and successful outcomes by keeping in mind the available resources at hand. Next, T is for timely or time-oriented or time-bounded or time-bound. So kailangan meron kang ilalagay na deadline to focus on. For example, after 8 hours of nursing intervention, the patient will display signs of effective airway clearance as evidenced by absence of dyspnea, cyanosis, and respiratory rate within 12 to 16 breaths per minute. See, it's specific, it's measurable, it's attainable, realistic, and time-bounded. Okay? Next is sa atin ng mga interventions, sa nursing interventions. Okay, sa nursing interventions naman, dalawa din ang tatandaan, okay? Meron tayong mga independent and dependent na mga intervention. So, kapag independent, ito yung mga kaya mong gawin as an RN na hindi mo kailangan ng order ng doctor. Like for example, mag-check ng vital signs, di ba? Mag-document. Mag-document ng yung observation sa patient. No, that's an independent nursing action. Kapag dependent, yun yung mga kailangan mo ng order ng doctor. Siyempre, number 1 na dyan is kapag medications, IVs, mga ganun. So, ito yung dinagdag natin, yung rationale. Nilagay natin sa ADPI. Yung rationale naman is nilalagay natin to support yung dun sa ating interventions kung bakit natin ginagawa yung certain interventions. Gusto natin i-provide na care sa ating patient ay evidence-based practice, hindi yung ginagawa mo lang to para saan. So dapat may rationale kung bakit natin ginagawa. So for example, ang patient mo may fever and isa sa mga interventions mo is provide TSB or tepid sponge bath. So syempre ang rationale mo it's because TSB is a non-pharmacological measure to allow evaporative cooling para mag-decrease ang temperature ng ating patient. So that's our rationale. And actually sa interventions and rationale, dun sa NANDA book, meron siya dun. You can use it as a guide. Syempre hindi mo siya kopyahin lahat, no? Kailangan mong i-scan yung information at gamitin lang yung mga applicable lang na mga interventions sa yung patient. Kasi usually sa mga guide, generalized ang mga nandun na mga interventions and rationale. Example, ako, dito ako nag-duty sa Eastern Samar, sa provincial hospital. Hindi naman high-end ang hospital, hindi private. So, for example, again, may fever ang patient. Sa NANDA, or kapag nag-search tayo online, ng mga NCP for fever, let's say for hyperthermia, isa, for example, sa mga interventions is provide hypothermia blankets or cooling blankets. Hindi ko ilalagay kasi hindi ko yun magagawa sa patient kasi hindi yan available. Okay, so yun yung ibig ko sabihin na kailangan i-scan mo. Hindi lahat ng makikita mo doon sa guide na sa search mo is ika-copy mo. Okay, so lastly, is yung ating evaluation. So, dito sa evaluation, dito na natin i-assess kung naging effective ang ating interventions at na-met natin ating planning or ang ating expected outcomes. So, kapag nilagay natin siya, parang same din siya sa planning. Like, pwede na tayong maglagay ng goal, met or unmet. Tapos, nalagay natin nga na after 8 hours of nursing interventions, So depende kung na-meet or hindi na-meet yung ating mga expected outcomes. So dito kasi tayo mag-decide kung yung interventions ba natin is itutuloy natin or tatapusin na yung interventions kasi pwede kang mag-reassess sa patient. May nagbago ba? Kailangan bang baguhin ang nursing diagnosis? Kailangan ba natin baguhin ang planning? So dito natin malalaman yun sa evaluation. Okay, that's it for nursing care plan. I hope you learned something today. Bye!